Good afternoon, everyone. Today, POPMA Study Club International Series, 31st October 2025, from 3 p.m. onwards. It gives me an immense pleasure to welcome you all to yet another insightful session of the POPMA Study Club International Series. I am Dr. Bhuvan Nagpal, founder president of the Practicing Oral Pathologists and Microbiologists Association, commonly called as POPMA. After an exciting conference and festive season, it feels wonderful to reconnect with our community in this October 2025 edition of our study club, an academic tradition that continues to strengthen our shared mission of knowledge, ethics, and clinical excellence. Before we begin today's lecture, I am delighted to share that PopCon 2025, the first national conference of POPMA, was successfully conducted in online mode on the 4th and 5th of October 2025 under the theme Atmanirbhar Oral Pathologist, Making Oral Pathologists Self-Sufficient. The event was organized with due permission and oversight of the Haryana State Dental Council. The highlights of the conference are: total delegates were 246, including 18 speakers, out of which 16 were national and 2 international. We had 42 scientific poster presentations evaluated by an expert panel. There were 41 institutions and industry collaborators as our knowledge partners. We had international participation, and delegates from the US, UAE, Australia, Cameroon, Greece, Malaysia, and Saudi Arabia have attended the conference. Overall feedback score was 4.7 out of 5, reflecting strong academic standards and engagement. The two-day event featured 27 hours of scientific sessions across diverse themes, including oral oncology, oral microbiology, oral medicine, CBCT, setting up oral pathology lab, forensic odontology, all reinforcing POPMA's vision of building self-reliant oral pathologists. With the resounding success of PopCon 2025, we are now gearing up for PopCon 2026, which promises to be even more dynamic and globally integrated. It is now my distinct honor to introduce our esteemed international guest speaker for today's session, Professor Dr. Jaws Hill. Professor Hill is a globally recognized oral and maxillofacial head and neck surgical pathologist with over 43 years of experience as a diagnostician, educator, academic leader, and researcher. A graduate in dentistry from the University of Groningen, Netherlands in 1982, and a specialist in oral pathology from the University of the Witwatersrand, Johannesburg, 1986. Professor Hill has served as professor and head of oral pathology at the University of Western Cape, South Africa, and continues to mentor and head diagnostic excellence across Africa and beyond. His pioneering work in head and neck cancer, salivary gland pathology, bone lesions, and oral mucosal disorders has deeply influenced diagnostic standards in the sub Saharan region. He has also led collaborative initiatives under the WHO Center for Oral Health, fostering regional integration in oral pathology education across Africa and Southeast Asia. Currently, he serves as a lecturing professor at the University of Namibia, manages the Oral Diseases Clinic in Cape Town, focusing on advanced diagnostics and functional medicine, and also heads precision head and neck diagnostics for Africa with the name Fanda Health. Sir, it's an absolute privilege to have you with us today. On behalf of the entire POPMA governing body and the Oral Pathology Fraternity of India, we extend our warmest welcome and deep respect for your lifetime contributions to our field. Before concluding, I take this opportunity to extend heartfelt gratitude to Professor Jaws Hill for gracing us with this presence and sharing decades of clinical wisdom that transcend geographical and institutional boundaries. I also thank all the members and the attendees of POPMA Study Club for their continued support and active participation. Your enthusiasm keeps this platform alive and evolving. Let us continue to learn, collaborate, and build a future where oral pathologists are not only diagnosticians but visionary contributors to healthcare policy and patient welfare. Thank you once again, and with that, I invite Professor Hill to begin today's session. Welcome, sir, and over to you.
Good afternoon, everybody. I presume it's afternoon in India. It is my pleasure to talk to your esteemed organization. I have prepared a lecture that is a bit unusual in terms of with an unusual title, which is called "Master's Orders Are Not Just Only Oral Diseases." I just want to do a check here to see if you can hear me and if you can see the screen.
If it can be, if you can be bit louder, or you can increase
Yeah,
the
a bit
volume of
louder.
the, yeah.
Okay, let me see how that works. Like this? I don't know.
Yeah,
Um,
yeah, it's
okay, good, good. So I wanted to talk to a subject which actually starts to interest me more and more after many years of histopathology and also quite a few clinical years diagnosing oral mucosal diseases and being involved in head and neck cancer. I I have actually been very inspired by the current advancement of knowledges with regards to the fact that the mouth is just not an organ on its own when it presents with disease, but basically that mouth disorders are actually not just only oral diseases, and that is the list logistics of this talk. This is it's not a new concept, but I think every day we see a new headline popping up that, and in particular in the microbiological sphere, that the relevance of oral inflammation and the manifestation of oral inflammation both ways play an important role in general health, and also now start to form part of integrated and functional medicine. And I have also shifted in my own clinical practice from just being a mucosal and otherwise diagnostician to a much more integrative approach, using functional medicine as a tool to get to number one, a correct diagnosis, and number two, a meaningful pathway for patients to heal from their oral diseases. And this is it's quite a steep pathway up the hill, I must say. But over the past 2, 3 years, I've actually gained a lot of insight, and also recently there was a very stimulating lecture in this regard by a renowned dermatologist from the United States on oral pathology 360 IODCP. And I also have a lot of inspiration from her with regards to the psychological and the stress background of oral diseases. So, um, why am I not advancing? All of a sudden, my screen is locked. How is that possible? Here we go. So, basically, when I give a sort of a personal opinion on what oral health is, and then one could actually just suffice for describing the various oral diseases, of which there are textbooks full of written text and diagrams and pictures. And we do that in traditionally to our undergraduate students. Uh, I don't think that that is sufficient anymore. And we're more starting to realize that when it comes to our mouth disease and mouth health, basically we're also really talking and influencing our own health and our own self-esteem in particular of of that of our body when we're coping with mouth diseases. Now, in 2011 already, the fields of dentistry and medicine were still quite far apart. But in Scientific American, there was this one comment that was made that in the light of the growing evidence pointing to the important links between oral and the whole body health, the separation discipline is slowly beginning to change. And we're seeing that happening more and more. Just want to remind the audience that oral disease is the fourth most expensive condition in many industrialized countries. And people with it impacts very poorly on people with compromised oral health and actually whole communities, and that's throughout the world, which results in pain, suffering, impairment, and reduced quality of life. And we all know about that. India and Africa, in particular, are burdened with the largest global increases of oral diseases, and this is what actually links the two continents. And that's why I'm so passionate about a link between Africa and India when it comes to sharing and also hopefully together developing new pathways of oral diagnosis and oral healing. Now, in India, about 85% of adults in India suffer from oral diseases, which includes cavity gum disease and in particular oral cancer. And we have got highly unreported data in Africa, but we estimate that at least 44% of the population in the African region suffers from oral diseases. And the two regions, together with Southeast Asia, are amongst those which have experienced the steepest rise globally in oral disease cases over the last 3 decades. And the question is, what is that? Why is that? Well, number one, the spending on treatment of oral diseases and in general of general health on these continents remains extremely or very disproportionately low to the general health expenditure. India spends about $1.21 USD per year per person on oral health care in 2019. And currently in sub-Saharan Africa, 70% of sub-Saharan countries spend less than $1 per person per year on oral health care. And that is extremely low when you compare it to global standards. The high-income countries often spend 50 to or 300 US dollars per person per year on oral health. So there is a big disparity when it comes to that. But not only in India and Africa, but globally, oral health care is understaffed. Now, that lack of investment leads to limited access to dental care, inadequate prevention programs, and overall shortage of oral healthcare professionals and workers, and especially in our respective continents, but also in Europe, we are starting to see the lack of oral healthcare workers proportionally to what it used to be. In Africa, there's only 3.3 dentists per 100,000 people, which is 1/10 of the global ratio. In India is about 4 times better, between inverted commas, where we look about 13 dentists per 100,000 people. But the WHO recommends 70 dentists per 100,000. And in income countries, the ratio often exceeds 60 to 100 dentists per 100,000, which, we compare that to both continents, Africa and India, is obviously uh, and we need to really realize that most oral health diseases can be prevented without medical assistance through a healthy lifestyle, a well-balanced diet, and good oral hygiene. And we know that, and that's what we teach our undergraduates from the beginning, and this is what we try to impart on our patients all the time. But what we really do not emphasize enough is that oral diseases significant health burden alone is high, but also it has a detrimental social and economic impact. This restricts individuals' participation in society where it's most needed. It leads to productivity loss, as well as learning disruption among school children. And we have been trying for the last 25 years to generate a shift towards preventive care and public-private partnerships in order to reduce the cost and improve health outcomes. But I don't think that we overall are being very successful, and it's mainly economically driven. First of all, number one, the difficulty is inherent in the nature of oral disease itself, because what can we read into oral disease? And that very much depends on the level of expertise that one is it during professional development. But in general, for the population at large, oral disease is something still of a mystery. And it is quite sad that for many oral diseases, especially mucosal disease and others, the general population still seeks the help of general healthcare practitioners and not of dentists or specialized oral healthcare practitioners. And I think that's partly to do with the emphasis that we place or the de-emphasis that we place in our curricula all over the world with regards to the importance of oral the relationship between oral health and general health. And they are very complex, we know that. And I don't have to go any further and convince this audience that there fortunately is no barcode to read oral diseases. And on top of that, even if you think that you recognize it, they're still difficult to categorize. So I have sort of in my sort of developed and this is by far imperfect, sort of diagram of how I currently see the interaction between psychoneuroimmunology, the NICE system, the diet, how this impacts on the relationship between oral dental diseases and the systemic diseases and conditions. And you can see from the arrows at the bottom, 2/3 of the diagram, how these interrelate and are reciprocal. But I would like you to take it to the upper part, and I'll come to that towards the end of our talk. What the role of the mind is, that is obviously in connection with the brain, including the hypothalamus, on the development of general and oral diseases. And I think here we are starting to look at very beautiful models that are being proposed these days. And I'm going to go a little bit further towards the end of this, or by the second half of this talk. But it is very important that when we look at oral diseases, that we do have in mind that there's a connection between the state of mind, and that you could hyphenate the word disease into dis-ease, through the brain pathways, neural pathways, its impact on the nervous, endocrine, cutaneous, and immune system. There is the impact of the diet on that interaction, and then the development of these various, may even be simple by dental caries or very complex by autoimmune diseases, and the interaction between these factors. We know that already that periodontal disease, there's an impact of common oral disease on general health, and particularly through the state of inflammation generated by a periodontal disease, and that poor oral health and gingival periodontal diseases are a threat to the general health. And we know that the inflammation that is the periodontal inflammation or the gingival inflammation, but particularly periodontal inflammation, can have a continuous poor impact on our general system. And we start to recognize basically the good and the bad in periodontal disease. And we're starting to recognize more and more of these components. If we look at and I've actually got a diagram that I put together, or that I got from an article, and we can actually look at what is the good about good periodontal health, and what are the factors that could promote good periodontal health, which is supra-subgingival biofilm homeostasis, homeostatic immunity in the gingival periodontal tissue, healthy dietary constituents, and an absence of chronic inflammatory disease at distant sites. That is the good in good periodontal health. And then healthy periodontal tissues in turn reduce the risk of oral carcinogenesis, and bidirectionally affect systemic health, such as that chronic inflammatory disease risk is reduced. And that's for we place so much emphasis on good, not only dental health, but gingival and periodontal health. We know that chronic periodontal disease is multifactorial, and that psychosocial stress plays an important role in the behavioral change of any patient. which includes, in particular, the use of tobacco or smoking, or overeating or a high-fat diet. Poor oral hygiene and poor compliance with oral health maintenance is something that we as dentists are always been trying to fight at the forefront when we are treating our patients. But these factors, together with bacterial infection, we all know, and then in stressful situation where cortisol is, and it's a very simple model, cortisol levels are increased, this leads to periodontal disease. And so if we actually analyze a little bit further, what are the factors that promote periodontal disease, which is a biofilm dysbiosis, where basically we do know that the composition of the biofilm, the bacterial biofilm, is very much changed in gingivitis and periodontitis. That there have been many factors that can influence it, and it obviously includes the diet. But we also now recently have found that often uncontrolled gingival and periodontal inflammatory response are modulated by the psychological stress, which is paralleled by the elevated cortisol release, which I just talked about just recently. And if you look at this very busy picture, you can actually see that periodontal and gingival health have got a lot of influences on the local environment, local oil environment, but also in the distant um, general health environment, and is a driver of chronic inflammatory diseases, not only in the oral cavity, but also in the body. So these are the factors that I mentioned before. We've also actually learned a lot about how COVID-19 the suffering of COVID-19, the severity of disease was influenced by bad periodontal health. And we do know that people who are prone to this develop the presence of tenacious bacteria that sort of generate an immune attack against the layered biofilm. And then we basically we're in compromised patients, and most of them are actually compromised in that regard. We're in a heated struggle between ongoing events that result in inflammation and gum destruction. And this is where periodontists are. We have recognized that bacteremia is already a fact in chronic periodontitis, but that diabetes, problems of the cardiovascular system, including endocarditis, aspiration pneumonia, immune system stress, and the triggering and worsening of autoimmune conditions, including arthritis Sjogren's, osteoporosis, and low birth weight, are associated with poor periodontal health. And recently also, what I would like to add is that we now recognize that poor periodontal health can be a risk factor in oral carcinoma. It can induce cell senescence in healthy cells. It promotes systemic inflammation, and so therefore we've seen a rise in inflammatory bowel diseases. Talked about COVID-19 complications, and now recently also there's more and more emphasis on the role of periodontitis and certain bacteria in the development of mental deterioration, including Alzheimer's disease. So I don't have to go basically what are the mechanisms of periodontal systemic connection, but the periodontal pockets that harbor the oral anaerobic bacteria and viruses can enable to release them systematically through the highly vascularized granulation tissue. And with that, you get circulatory release of pro-inflammatory cytokines, bacteria, and their byproducts. That we have leukocytes that circulate, which cause low-grade inflammation and ectopic disposition in distant organs. And there's a little diagram here that I've actually found very useful. What are the sort of schematic representation of a disrupted gingival biofilm that through the increased periodontal vasculature and chronic inflammation basically has got its influence on various issues in general health. We do know about the vicious triangle relationship between diabetes, periodontal disease, and obesity. And that has to do with the cytokines are being produced by fat cells. We know that obesity can intensify infections such as periodontal disease, and that by on itself, diabetes increases the risk of periodontal disease and vice versa. So this vicious triangular relationship between obesity, periodontal disease, and diabetes is actually now well known. And we do know that periodontal disease can affect the patient's ability to control blood sugar levels, which is actually already known for the last 24, 25 years. And it is not something that really we actually tell our patients. What the relation is between the metabolic syndrome and what a lot of our patients now find themselves and inflammation and periodontal disease is the fact is that or the obesity-induced adipose tissue inflammation drives this metabolic syndrome, which eventually leads to insulin resistance. And together of the role of in aggravated macrophages triggered by hypertrophic adipocytes, we see the feeding into the continuance and obviously the promotion of periodontal disease. And this is something that we need to actually communicate a lot more clear to our patients. What are the main oral effects of diabetes? I don't really have to go through this, but it's often rampant dental caries, periodontal disease itself, fungal infection, mouth ulcers, dry mouth, and even burning mouth. And they each on their own actually can require a lecture. So this continuous oral-derived inflammation that is now well known to be linked to heart diseases, and we see more and more about the poor the role of I would say bacteremia in bronchitis that from continuous periodontal inflammation increases the risk for cardiovascular diseases. And that basically includes atherosclerosis and thrombosis, coronary heart disease, and cardiovascular disease and all. But you can see that on the top of all that, a lot of that is initiated by not only genetic susceptibility, but also a poor lifestyle that includes smoking, bad diet, and that dental caries also obviously still plays a role. We mustn't forget about the fact that the effect of tooth loss on poor chewing ability compromises the diet and nutritional status of patient. We know about cardiovascular health in the inflammation age and why we do get atherosclerosis, and that it mainly the complications of that are derived from the inflammation that is present in these atherosclerotic plaques. We saw in COVID-19 that there was a risk for aspiration pneumonia due to the presence of adverse bacteria in patients with periodontitis. And so there was this extra complication of bacterial infection in otherwise already compromised patient with COVID-19. And this was actually highly under-recognized, but intubation itself was a risk factor for those patients. And it was also found that SARS-CoV-2 can independently replicate in the oral cavity in epithelial cells, so that patients with SARS-CoV-2 actually were harboring the very infectious viruses in their periodontitis affected gums. So this is something that we have learned from our COVID experience. What also every woman needs to know is that there is a growing evidence of that poor oral hygiene during pregnancy can adversely uh, affect the health of newborn, and that there is a relationship between oral disease, gum disease, and osteoporosis, which is well known. Inflammation basically plays a big role with the Renko OPG pathways, where osteoclasts are activated to resorb bone under the influence of the various cytokines and chemokines that are released in chronic inflammatory states. And we know that diet and nutrition can play a big role in that in general, and this is what we are teaching our patients: tooth development, gum, oral tissue integrity, bone strength, any occurrence, prevention, management of disease of the oral cavity. And this is basically what it practically comes to, but it's not enough. Let's just have a look at quickly at obesity worldwide. It is actually at the moment thought that about 43 million people for obese children under the age of 5, and we see this every day on the news that obesity is increasingly becoming important in our society. Now in South Africa, we've been looking at this issue now already for the last 11 to 12 years, where we found that a lot of South Africans, despite the disparity in economic disparity, that obesity is increasing amongst our population and our children, and that obesity is a major risk for cardiovascular disease, mainly due to the convenience foods. In India, the same is happening. It's following a trend, and that there's an epidemic prevalence of about 40.3% in the 21st century of pre-diabetic or diabetic obesity patients, and that 5% of the country's population, of India's population, is actually affected with morbid obesity. And that is as a result of the unhealthy processed food that has become much more accessible following India's continued integration into global food markets. And, from my experience, often looking at the Indian media, I can see that in the last 5 to 6 years, this has exponentially increased. But NGOs such as the Indian Heart Association have been raising awareness about this issue, and you probably know more about it than just me. We know about the deleterious effect of cryogenic food and soft drinks that promote the formation of dental caries. We in our hospitals here in South Africa, we often see children in the morning at 7 o'clock standing in the elevator, going to the various outpatient departments with chips, a packet of chips and Coke as a diet, as a breakfast in their hands, because they had to get up early, to come in time for the waiting queues at the hospitals, and they get fed by the tuck shop with Coca-Cola and chips and other cariogenic foods. And we know how popular sodas are all over the world, but how misunderstood the role of the consumption of soda is, and that including energy drinks on not only the maintenance of dental integrity, but also obviously on general health. So we know about that the the excess in sugar and carbohydrates results in obesity and heart diseases. We've been there.
Yes, yes.
Okay. All right. So let me see what happens here. I'm just going to skip a few things here because we've lost some time. Um, I wanted to really quickly talk about, well, obviously the deleterious effect of sugar and carbohydrate intake. And what is important is to realize that they induce reduced immunity and impaired healing. And the other most important thing that we tend to forget is that a dry mouth due to frequent urination and diabetes disrupts the oral bacterial ecosystem. Now, we know the issues associated with advanced tooth decay, with the loss of the ability to chew. And but very quickly, we know about the effect of nutritional deficiency in oral health, in particular iron, vitamin Bs, folic acid, zinc, vitamin D, especially after the COVID-19, we've actually discovered the importance of the role of adequate vitamin D levels and of adjusting them, and omega-3 fatty acid. I should actually now also mention the importance of the advocacy for probiotics. I don't have to really go into iron and vitamin B12 deficiency because they're the common cause of glossitis, because of burning and mouth fungal infection. But you'll see at the end how interesting it is, how this ties up together again with vagus nerve deregulation. So I just don't want to, and AFTAS also. So I would like you to just remind yourself of these very common conditions that we think are to do with vitamin D deficiency and and other nutritional deficiency, but how this actually interplays with each other. We know the importance of serum iron levels that can lead to anemic-like conditions, which is glossitis, trophic stomatitis, burning mouth symptoms, increased risk of oral infections, delayed wound healing, and even reduced saliva production. But there's something that I want to come back to. So, how is reduced saliva production associated with low serum iron levels? The reason why I'm talking about this, you will see later, is that it's iron is essential for the proper function of various enzymes and proteins involved in salivary gland function. So even decreased salivary flow and iron deficiency can impair these processes. We know about the impact on oral tissues. We know about the impact of low iron levels on systemic effects. And we know that iron deficiency often goes with other nutritional deficiency, which on their turn again can further impact salivary function and saliva production. I'm not going to talk in details about vitamin D, but we have upped the levels at the moment for sufficient vitamin D levels from 30 nanogram per liters to 40 nanograms per liters in terms of sufficiency. Then I would briefly like to mention that we can have oral manifestations of systemic disease due to celiac disease, which can result in atrophic stomatitis, atrophic glossitis, angular colitis, burning mouth syndrome, dry mouth, and even oral lichen planus because of the shared autoimmune nature. And you'll see how important it comes. After ulcers, glossitis, ulcerative colitis. We know about the influence on the manifestation of FT, canker sores, and peristhalmus stomatitis. And then, very importantly, we are starting to focus on the relationship between good gut health and oral health. And we now know that there is a bidirectional communication between the oral and the gut microbiomes that communicate through various pathways, including the bloodstream, the saliva, and the gut-brain axis through the vagus nerve. I'm going to spend some time on this just now. And this bidirectional communication helps to regulate physiological functions and pathological processes. So, not only that gingival periodontal disease can lead to an overgrowth of harmful oral bacteria, when these bacteria are swallowed, they can also affect the gut microbiome, which can potentially lead to conditions like inflammatory bowel disease. And that is not being stressed enough at the moment in our teaching. Then also, as I said, I mentioned the role of diet and probiotics, and it's more and more important to emphasize that our patients should have a balanced diet rich in probiotics and nutrition-dense foods. And I, at the moment, do recommend high colony-forming unit Lactobacillus cultures to help maintain a healthy balance of beneficial bacteria in the gut, which supports oral health. And a healthy bacterial balance in the gut helps good vagus tonia. And I'll talk about it. I'm not going to go too much into thyroid disorders that can significantly oral health impact, but we know all know that through autoimmune diseases and the direct signals from the brain, we can have dysfunctional thyroid health, and that can actually also induce various oral health problems. I don't have to mention much about HIV and AIDS and its oral manifestations because it's pretty much prevalent um, in our communities in India and Africa. But I really would like to spend the rest of my talk on the hidden triggers of oral diseases and how stress leaves its mark on the mouth, having revisited all these other factors, and there are many, many more. And this actually introduces the concept of psychoneuroimmunology, where we look, we, which basically puts a kind of a framework for understanding the pieces of our health puzzle by being by interlinking with our psychological response, our immune system response, our endocrine system response, and our peripheral nervous system response. And psychoneuroimmunological pathways are now recognized as being um, very active in a lot of what we used to be calling non-specific mucosal diseases. And I'm just going to go into that. If you look at that first diagram that I showed in the beginning of the lecture, of the relationship between the state of mind or the disease of the mind and its interaction on the brain with its connection to the hypothalamus, what the effects are together with the diet on the immune system. And as a result, the health of the skin, the vascular system, and the mucosal tissue. And very much we think that at the bottom, or basically the root cause of autoimmune disease condition, is basically a disrupted psychoneuroimmunological pathway, which can nowadays or be also explained by vagus nerve dystonia. We know that there are many oral manifestations of autoimmune dermatosis and lichen planus and discoid leukocyte erythematosus, benign mucous membrane pemphigoid, pemphigoid vulgaris, and to name another few, very much can manifest in the oral cavity, and often they are the first to manifest. And we also know that inflammation and erythema multiforme particularly, who is actually a non-specific reaction or like a hypersensitivity reaction to, let's say, a viral infection or another inflammatory disease or in gingivitis, are very much interrelated. So we now more and more start to realize that the mouth mirrors the mind or the state of mind. In other words, if the mind is not in a good frame of mind, then we can expect in the long run oral mucosal and other diseases. And when we relate it to the fact that 70% of dentists all over the world now report seeing an increase in patient experiencing conditions linked to stress, which is very important. And we see this over and over and over on the media, then we can start understanding a little bit more about the interrelationship between the brain, systemic disease conditions, oral and dental diseases, the poor diet or the lack thereof, and the what we call the NICE system, which is the network, the NICE network, which is a complex network that involves the bidirectional communication between the nervous, the immune, the cutaneous, and the endocrine systems. And this integration and the nervous system is basically the ruler of the orchestra in the NICE system. But it determines very much on how these other three very important components. And when I talk about cutaneous system, I implicitly also include oral mucosa. The integration of these four components is facilitated by neuropeptides, cytokines, and hormones. So if everything is in nice balance, the nice system, and it's actually nice to say to the patients, listen, what we actually really care about is that you are nice. In other words, that you got a good nervous regulated system, a good endocrine functioning system, your immune system is good, and that your skin and your oral mucosal health as a result are in a better shape. Now, the NICE system, if it's in a normal state, parasympathetic and autosympathetic state, it ensures a coordinated response to stress, injury, and inflammation. So when we're not taking into consideration all these factors like we discussed, like chronic inflammation, periodontitis, bad diet, um, and basically a disease state of the mind, then this system keeps us nicely in balance, and we have a relatively disease-free life. But as soon as stressors come into play, then we see that these components, especially the nervous system, the endocrine system, and the immune system, are starting to react. And we can dissect that into, and obviously they are into interactions with each other through cytokines, hormones, neurotransmitters, which obviously, and we've seen, for example, like in the state of diabetes or metabolic syndrome, are very much disrupted. But if we look at individual manifestations of nervous system dysfunction, we look at anxiety, depression, insomnia, which is actually very much recognized these days in our society. We look at thyroid, adrenal, gonadal disruption, functional disruptions, and in particular the weakening of the immune system, which results in inflammation, infections, allergies, and pain. So, Dr. Borges basically put these states of the nice system, these various disruptive states, into three main spheres in which we in society can find ourselves in, and it can vary from hour to hour, minute to minute, and day to day. We can either be in a relaxed state, or in a mobilized state, or in an immobilized state, and there's an interaction between these three states. But when we're in a relaxed state, then our parasympathetic nervous system, which is mainly regulated through the ventral vagal pathway, really keeps us in with a nice normal heart rate, good muscle tone. We are relaxed, we engage, we're curious, we're creative, we're hopeful. But we can have also got a bit of a hybrid state between the relaxed and immobilized state in terms of quiet moments and intimacy. And when we're in a mobilized state, in the hybrid state between mobilized state and relaxed state, we can be actively involved in playing, dancing, sports, and performance. And this is necessary for an exciting life. But when there is a hybrid state between in an immobilized and a mobilized state through, on the one hand, a disruptive heart rate, disruptive blood pressure, disrupted hormone flow, disrupted muscle toning, um, and in basic and the emotions caused by a stressful mind, which can either be if one is in a disease-free or relatively free of disease or in an ease state, one can be energetic, active, playful, motivated. But when the mind is in a dis-ease, in a state of dis-ease, then we're more into a fight or flight situation. We can be stressed, we can anxious and fearful, and even worse, when this degenerate with this actually jumps into an immobilized state where the dorsal vagal pathway in this particular case. So remember, what I want to say basically is to put your attention to that there's a ventral vagal pathway and a dorsal vagal pathway, which are both part of the parasympathetic nervous system. And this is characterized with associations like emotions like uh, uh, feeling basically unhappy, depressed, loneliness when it's on the wrong side. But when it's on the right side, we can be mobilized, but blissful, dreamy, tranquil, and meditative, which is great. And obviously, in our lives, we are trying to achieve a nice, healthy balance between these three states. Um, as illustrated by Stephen Porter's polyvagal therapy. And you got to look at the role of the autonomic nervous system elevator, where the vagus nerve, the dorsal and the ventral vagus nerve actually activity basically result in three states, as I illustrated in the previous diagram, where there is a good social engagement system. We call that the penthouse. when there is a feeling of safety and connection, which is very much governed by ventral vagal tonia. And sorry about this. My apologies for that. I can't switch my phone off. These iPhones are more difficult these days. We can be in the mid floor, which is in the state of mobilization, where there is a activation of the sympathetic neural system, and we usually will call it the fight or the fight system. We can experience cues of threat or danger, chronic stress or anxiety, or there can be a greater conflict in relationship, and we can even be what we call in the immobilization stage, which is the basement compared to the penthouse or the mid floor, where there's a dorsal vagal collapse and shutdown, as opposed to a good functionality, where we experience immune suppression and perpetuate disease severity. And I think this is the driver of most of our chronic diseases, including autoimmune diseases. So the vagus nerve is the elevated motor. So the vagus nerve allows us to move in between these various states. And we talk about vagus nerve dystonia. The vagus nerve is part of the peripheral nervous system and is the body main's communication pathway. And this is getting more and more attention now in body therapists and physiotherapists and kinesiologists. When we look at the vagus nerve itself, 85% of the virus carries sensory information from the body to the brain. And that regulates the gastrointestinal tract, the cardiovascular system, the endocrine function, and our emotions. So very much a good vagal state, a good state of the vagus nerve actually really maintains a nice system, as explained before. If there's a weak vagal tone, then the elevator gets stuck, and we get stuck in one of our dysfunctional emotional status, which then can go together with increased stress reactivity, inflammation, and emotional distress. And therefore, strengthening the vagal tone basically will allow us to restore nervous system flexibility, because we don't want to freeze completely. We want to be able to have our dorsal vagal and ventral vagal neural system firing as is needed. So the emotional impact and the need for coping can cause, which are basically unprocessed emotions and toxic stress, office stress, can cause the so-called elevator or the vagus to get stuck on the battlefield or the basement. And that alters our immune function, our cytokine signaling, and our cortisol levels, and that feeds very nicely into our chronic states. And the most important one in our field actually is periodontitis and salivary dysfunction. So what we do, instead of actually seeking a good, uh, what we say, functional health, we go into behavioral problems. We respond with overdrinking, overeating, overworking, excessive exercising, and doom scrolling, as we're now seeing, which is becoming an issue with the mobile health devices. So it's a vicious cycle. We jump from mental stress to activation of stress response, to release of stress hormones, to inflammation in the body or the skin on the oral mucosa, which can flare up these conditions. We we impair our skin or oral mucosal health barrier function. We impair our we suffer from immunosuppression. We impair wound healing and increase itch irritation. And right, we see that before when we actually have a disruption on our neurological, immunological, cutaneous, and endocrine system. That by itself can trigger these mechanisms, which can then result in anxiety, negative self-talk, shame, and so goes the circle. So on goes the vicious circle of stress and oral disease. You get that? So no wonder that the mouth is a stress organ, and that we should see the oral cavity as a neuroimmune interface and a stress target. Because we know that stress shifts the ecosystem. It reduces our salivary IgA, which is our first line of defense. And by the way, the vagus nerve actually does immediately innervate the parotid gland. So vagal nerve dystonia reduces in a disrupted salivary flow with all its decreased functions as a result. So stress impacts the oral epithelial barrier function. It triggers neuropeptide like substance P, which increases the risk of inflammation, and it alters the microbial balance, which results in a dysbiosis. And I think this is largely unrecognized these days in our field. And I think we start teaching and paying much more attention to why do we have a state of dysbiosis, what is it caused by, and how can we actually um, repair or restore it. I already told you that salivary glands are directly controlled by the autonomic nervous system, and that the peripheral nervous system regulates salivary secretion, and that the sympathetic and parasympathetic nervous system jointly regulate salivary. So here, no wonder that chronic stress alters the morphology and the function of the glands, which then results in the shrinkage of cells, change salivary flow, protein shift, and as I already told you, these changes can shift the oral microbiome, increase inflammation, and impair oral defense. So this is basically schematically, what is the effect of psychological stress on the oral gut microbiota and the potential oral gut-brain axis? So we see that the hypothalamus pituitary adrenal axis is activated during active and chronic stress, very importantly. And then basically, when we divide acute stress into acute stress and chronic stress, we can see how it affects the sympathomillary pathways and the hypothalamic pituitary adrenal pathways. And I think it is very important. And basically, this summarizes what I've been talking about, the alteration of the cytokines, the altered cytokine homeostasis, a reduced anti-inflammatory response, increased pro-inflammatory response, suppressed immune system, cortisol, increase of cortical, and then basically the influence on the kidneys, the sympathetic and parasympathetic systems, the cardiovascular system, and so on and so on. So just very briefly, we know that stress alters the levels of key salivary proteins and hormones, increases cortisol, increases interleukins 1 beta, interleukin 6, increases tumor necrosis alpha factor, decreases hormones, interleukin 10, and salivary IgA. And that shit contributes to impaired immune function and increased inflammation. It disrupts the mucosal function and repair, very importantly. So when we are trying to chase the healing of oral mucosal disease, we should actually look at what actually is at the bottom or at the base of this disrupted mucosal function. It then includes obviously reactions to autoimmune processes. And we should spend a lot more time and effort on understanding what oral dysbiosis is all about. Because we know that the microbiome is under pressure by stress hormones, and we know that noradrenaline affects the growth of P. gingivalis and Actinomyces, and then stress reduces the microbial diversity we so much need, and that increases the risk for oral lichen planus, recurrent after ulceration, Sjogren's, and herpes simplex virus infection. So a state of dysbiosis fuels inflammation, it impairs healing, it amplifies disease progression, and worsens oral mucosal disease outcome. And already, as I told you, oral microbes can migrate to the gut, especially when stress impairs mucosal immunity. These translocated bacteria can trigger intestinal inflammation and worsens gut dysbiosis. That in itself has an influence on vagal dystonia, especially ventral vagal dystonia. And there's also the other pathway is that evidence suggests that oral bacteria may reach the brain via the blood or trigeminal nerve pathways. And so the microbial shifts in the gut and in the mouth are bidirectionally linked with mood disorders, anxiety, depression, and cognitive decline. So don't forget that nowadays we do have to look at the vagus nerve as deconnected, that links the gut, the brain, the mouth, and the feedback loop. And that there is 80% of the fibers of the vagus nerve send information from the body to the brain, and that stress reduces vagal toning, which decreases anti-inflammatory signaling, and impaired vagal signaling results due to the fact of its effect on salivary dysfunction in more disposed inflammation and neuroimmune dysfunction. So we have evidence now that there are at least six oral conditions that are fueled by stress or psychological distress, which is lichen planus, which is an autoimmune condition that worsens with stress. We all know that. We know that these patients suffer from decreased vagal tone. We know that herpes simplex virus outbreaks are facilitated by suppression of cellular immunity with reactivation, that it promotes the growth of P. gingivalis and T. denticola, worsening inflammation. We battle with aphthous ulcers, which is seen in an increased frequency in stressed individuals. Um, the stress in these individuals impairs mucosal repairs and autoimmune response. And we know that, for example, we look at that sort of basement state in Porges states of vagal dystonia, that it can be associated with lower IgE, that higher cortisol and increased loneliness can be associated with lower IgA1 levels. Periodontal disease is now recognized as a chronic stress disease as well. It's not only inflammatory, it's not only poor diet, it's not only poor oral hygiene, but stress is, and then basically that dysbiosis is increased, and then we don't forget about the vicious triangle, which is diabetes, obesity, and periodontal disease. Burning man syndrome, we know, is a strongly associated with chronic stress, anxiety, and mood disorders. That HPA-HPG axis disruption and decreased oxygen DHEA levels play an important role, and that there could be an altered function of nerves in the oral mucosa as a result, although I think it's probably more associated with vagal dystonia than with a true morphological alteration of the nerves in the oral mucosa. And even tooth loss, because of stress-linked periodontitis, we have progressive bone loss and eventual tooth loss. So these six important uh, diseases that we see in increased frequency and in most of our patients are all actually all probably fueled by stress. So the mouth is a messenger. And what does it mean for health providers? We need to rethink our symptoms, but that is just not a local infection, but a nervous system signal. We need to redefine our patient care. We need to develop more compassion, curiosity over compliance-based models, which is still going on traditionally. And I think what comes first is regulation, then restoration. Inflammation and pain don't resolve without nervous system safety, without basically attention for vagal toning. So vagal toning now as medicine and therapy is becoming very popular. We get no one can heal in a state of defense. We need to restore our safety to restore health. And you often hear from body therapists that when they treat a patient with body-based somatic tools, that includes breath work, gentle movement, vagal nerve stimulation, self-touch, patient patient, that they in general start feeling better, that they start to be able to control their disease and inflammatory stage much better, and that they feel a lot better emotionally and feel safer. We're seeing in the literature that some of the efficacy of somatic practices, which includes reduced activation of the sympathetic neural system, in reduced stress and improved well-being, increased increase in heart rate variability, decrease reported symptoms of post-traumatic stress syndrome, improve pain severity and pain intensity, improve cardiovascular health, improve metabolic health, improve blood sugar regulation and thyroid function, improve digestive system health, and very importantly, reduce inflammation, improvement in autoimmune inflammatory conditions, which is very much what we in oral medicine, in oral microbiology, are trying to find. So, what is the big picture? What really matters is that when we help patients increase the nervous system flexibility and increase the vagal tone, we're just not managing symptoms, we're creating the conditions for healing. And the takeaway message is that oral health is a window into the nervous system dysregulation, that chronic and traumatic stress impact immune function, inflammation, and healing, that the NICE network gives us a framework for integration, and then breath work and body-based practices are oral care adjunct oral care facilities and should be part of every oral care routine. So it's important not only for our colleagues and ourselves to look at what we see locally in the oral cavity, but what actually really we can do to support our patients. And it is much ado about the traditional nothing. In other words, for centuries we've disregarded, and now we start to understand really what actually is at the cause um, of actually our chronic inflammatory conditions that we battle with so much. Thank you very much.
Yes. So it was a wonderful lecture by Professor Jaws. Now I request Dr. Nidhi ma'am to kindly ask for the questions and give away the vote of thanks at the end after the question Q&A session. Over to you, ma'am.
Thank you, sir. Thank you, Josh, sir. It was a very good, detailed, insightful lecture. And no doubt, sir, you have covered very much in detail about how oral cavity reflects the status of different organs and how they are both related. Thank you so much, sir, for all your efforts. So, there is a question from Dr. Kiran Jadhav. What are the different ways to improve and strengthen in patient with autoimmune diseases? Uh, the
Okay, so
vagal tone, sir.
my the first line is obviously oral hygiene. I think that every patient that is suffering from an autoimmune mucosal disease, the first thing that I hammer on is um, the maintenance or the reintroduction of good oral hygiene with the least sensitizing agents as possible. In other words, a lot of toothpastes and other so-called oral health facilities like mouthwashes and things like that are often irritating more than they help with the healing. That's number one. Number two is the restoration of the oral microbiome. Now, that is with a good diet, and that is also with probiotics. And thirdly, I would make sure that patients in general and that is even before one treats with topical steroids or any other kind of drug-related modalities, that we basically restore um, zinc levels, that we look at the iron levels, vitamin B levels, that this is well known, that we give them anti-inflammatory like omega-3s, that we look at also not recently, what I have found is that the introduction of the supplementation of vitamin E, 400 international units per day, helps very much with chronic inflammatory mucosal diseases like lichen planus. This is just basically lifestyle, making sure there is a balance of the magnesium, the zinc, the iron, and the vitamin D levels, restoration of a good oral microbiome, which obviously goes hand in hand with a good oral hygiene. These are these are the preconditions for a good management of autoimmune diseases. Then, obviously, depending on the character of the autoimmune disease, one actually looks at the appropriate modality. Now, we do know that we can do a lot with topical um, steroids, topical antifungals, and antibacterial mouthwashes. That we can, certain conditions have to be treated with systemic immunosuppressants like steroids and the more modern ones, like for example in pemphigus vulgaris. But and there are various ways of applying topical steroids in the oral cavity. You know, one can do it with mouthwashes, one can do it with application trays. But the most important thing is that we support our patients with a good um, oral, gut, nervous system support. In other words, that we tell them that, look, if you got a gastritis, you got a dysbiosis, you got an alteration, a dysbiosis already between the oral cavity and the gut, and that in its turn influences your vagus dystonia. And so the best way also to support that is to find somatic treatment or go to a physiotherapist or do yoga or do something to help your peripheral nervous system to restore itself and help you cope with all these factors that are in play when there's a disruption in the neurological, immunological, cutaneous, and endocrine system, the NICE system.
Yes, sir. Thank you. I think that suffices, clears the doubt. Any other question from the audience? Anybody wants to ask anything, please? You
I
can unmute
can't,
yourself.
I can't see the.
Yes, sir. There's no other question in the chat box though.
If anybody has a comment or any input, they are also welcome. I think we don't
I
have.
don't,
Uh,
I don't have access to the chat box, so unfortunately, I can't read if there's any questions there.
mhm. So now I request Dr. Nidhi uh, to give the vote of thanks.
Uh, on behalf of POPMA, the organizing team, we are very thankful to Professor Dr. Jocelyn sir. Thank you for taking out time for presenting such an insightful and detailed lecture, sir. Please accept this certificate as a token of appreciation from our side. Thank you so much, sir.
Thank you so much. I just want to see if I can. I'm trying to actually um, get online. Ah, here we go. There we is. Yeah. Hi. So, thank you very much.
Thank you,
I
sir.
hope that
Thank you so much
Thank you, sir.
for
I hope we're
your
able to
gracious
instill.
presence. And now I request all the participants, sir, can you stop sharing from your end?
Me. Okay. Um,
The stop share button will be there
yeah,
above.
yeah, yeah, yeah. Is it stopped?
Yes, yes. Now I request everyone to put on their cameras for a group photograph. Yes, thank you. Oh, hi, Dr. Nirenberg. Hi, Kiran sir. Hi, Dr. Patrice. Please switch on your cameras. Okay, here we go. One more. Thank you. Thank you so much, everyone. And November now. We'll see you all in November, and we are starting with two more series. One is the slide discussion series, and the other is the student series. So the slide seminars, you know that different cases will be there, and anyone who is interested to volunteer to share their cases and their knowledge, they are also most welcome. And for any access pertaining to any of the videos, you can subscribe to our uh, YouTube channel. It is with the name of Popma, and all uh, the knowledge videos are available there in the playlist year wise. So thank you so much, and stay tuned. See you all in November, and thank you so much once again. Bye. Thank you, sir, for your gracious presence.
Bye.
Thank you, Nidhi ma'am.
Thank you, sir. Thank you. Thank you, sir.
Okay, bye everyone. Bye.